Low-carb physician Dr. Kristin Baier says metabolic health matters with 9-1 DIVOC. Find out the details here today on Jimmy Rants. JimmyRants.com is the website, and as always, you can engage live in the content. Come follow me right here over on Instagram. I'm at Jimmy Rants. Make it easy for you to find us. We do go live at 11 a.m. Eastern Time, Monday through Friday, so be there, be square. We also simulcast over on Twitch, which is a new feed. Just added that a couple weeks ago. If you want to follow me there, I'm Jimmy Rants over on Twitch. It's an app you can download. I also put it in my stories here on Instagram where you can just swipe up and watch it right from the Twitch app on your phone. Don't even have to download it. Then we're also over here on Facebook. Thank you guys for being here today as well. And then finally over on YouTube, where Shirley just popped in to say, hey. Thank you guys for being here today on Jimmy Rants. If you missed the live, you can watch it on the replay. We got several places you can do that. First of all, right here on the Instagram feed, go to @JimmyRants, and it will be on IGTV just as soon as this is over. You can also watch the replay on Twitch, so download the Twitch app, follow Jimmy Rants, and you will find the show there and be able to watch the replay. We also put the replay up over on YouTube. And so if you type in a keyword Jimmy Rants, you will find the show over on YouTube. And which, by the way, I've got several things for you on YouTube. So if you missed the debut of my One Step Deeper podcast with Brittany, that aired on Sunday night and was up yesterday. So go look up that. Once you look up Jimmy Rants on there, you'll be able to find One Step Deeper. I've got them all categorized on my page. We also have up there today an older interview that I did with my friend Drew Manning. He's from Fit to Fat to Fit, and I interviewed him right at a decade ago. Well, he's currently in the midst of doing another one of those Fit to Fat to Fit things where he made himself fat on purpose only to show you how to lose weight. So I put up that video over on the YouTube feed today as well. And get ready, guys. My podcast schedule is back. And so tomorrow I got a brand new interview. Thursday I have a brand new interview. Got lots of stuff for you over on the YouTube channel. So go subscribe and hit the bell if you are over on YouTube. And then finally, for the best of the best and all of the episodes that you ever wanted of Jimmy Rants, that is at the official website, JimmyRants.com. And we sincerely appreciate you checking out the show. Okay, you guys, we are here today with a great topic. Let me pop it into the notes here so you guys can see exactly what we're talking about. Pin that bad boy to the top and we will be off to the races. Okay, so we have been in the midst of right at almost just under a year with 9-1 DIVOC and all of the everything that's been put out there about it. And I don't know about you, but I'm sick of the heavy drumbeat, and I've talked about this many times before on Jimmy Rants, but the heavy drumbeat of wear a mask, socially distance, stay at home, and now the new one is take the V word. And so all of these messages we've been given all year long over the past year about 9-1 DIVOC have been on these things that are, I suppose, at some level important, but are they the most important? And I have questioned all year long how good medical professionals, people in the realm of metabolic health, nutritional health, why we haven't heard more of them step up and speak out on the importance of metabolic health. And you guys know me, having followed me for many years, I've been talking about metabolic health and its extension to your total health forever. That's what nutritional health is about. That's why we have keto and low carb and carnivore and paleo and real food and all the everything that various people do. But metabolic health matters. Have you been concerned you haven't heard a lot of medical professionals, especially, speaking out about metabolic health and its relationship to what would happen if you got exposed to 9-1 DIVOC? I've been shocked at it, quite frankly, because there are a lot of people that know the connection and they've just been completely quiet. I don't know if they've been silenced. I don't know if they've been speaking, we just haven't heard them because they've been censored. There's a lot of stuff going on out there around this issue. Well, as it turns out, I have an article today by not just a medical doctor, but a low-carb medical doctor. I've known Kristin for a little while. Dr. Kristin Baier is her name. Kristin, Kristin, Baier, Baier. If you follow on Instagram, her moniker there, her username, Doctoring Keto. She just moved out to San Diego, California, and she's a part of a practice there called Low Carb MD San Diego. And so if you're looking for a doctor in the San Diego, California area, Kristin is your girl. And so Kristin penned this article in this magazine called San Diego Physician, which I thought that was pretty prestigious. She's new to San Diego, and now they've given her in this San Diego Physician put out by the San Diego County Medical Society. So this is like the American Medical Association, but on a local level, the San Diego division. This was published in the November-December 2020 issue. And so the article that she wrote is titled Metabolic Health in the Time of 9-1 DIVOC. Now, she writes the actual word, but I'm going to still speak in code so I don't get censored. Somebody actually asked me on Instagram yesterday, sent me a DM, why do you say 9-1 DIVOC and V word? Why can't you say, and she said it, and I'm like, So I explained to her, you do realize people saying those things are getting censored, right? Oh, I had no idea. And I'm like, how can you not know? It's happening everywhere. So anyway, I speak in code. You guys understand my code by now, but I guess a few people don't. But let's read this article. It's not that long, so we'll have plenty of time for discussion at the end. But Metabolic Health in the Time of 9-1 DIVOC by Kristin Baier, MD. Your patient returns to clinic for his quarterly check to reassess hypertension, which is high blood pressure, dyslipidemia, which is funky cholesterol numbers, and type 2 diabetes. Over the last few years, you've observed that his BMI slowly is breaking the threshold into obesity with an unfavorable waist circumference, hyperglycemia, which is high blood sugar, inching toward the need for using insulin, triglycerides elevating while HDL remains stagnant, and their blood pressure climbing to the verge of needing yet another pharmaceutical drug. All of this occurred despite his insistence on compliance with the dietary guidelines and trying his best to incorporate more movement into his day through the aches and pains of osteoarthritis. Let me pause a second. Isn't that so true? How many patients have gone to see their doctor and they have done obediently what they were told to do? Eat more healthy whole grains, cut your fat, cut your calories, exercise, and they've done every single one of those things. And yet they still have all these issues. So I never put two and two together before why I was struggling. I bought into the lie that my doctor reinforced, that since my genetics had a whole lot of things in it that made me more susceptible to obesity, more susceptible to some heart issues, other kinds of issues, that's the reason why I'm struggling. And then I'm going, but isn't there a nutritional plan I can do that would even help with that? Oh no, there's nothing you can do. Do you ever feel the defeatism when you go to see a medical doctor? I mean, I get it. They see so many patients and they see a lot of them not ever get better. So even in their mind, they have surmised that it must be true that doesn't matter what you do, you're just going to gain weight if you have a propensity for that. You're going to slowly go towards diabetes if you have that predisposition. And so all of these messages that they give to patients then becomes a self-fulfilling prophecy because they never help them find the root cause. And people kind of say, well, doctors should promote keto and low carb. They don't know about it, guys. I give doctors a bit of a break on that because they've not been trained in nutrition. They've not been trained as to what the diet is. And people are like, but all the information's out there. You've written books about it. Other doctors have written books about it. Surely they know by now, and you act like that these people spend their free time looking at that kind of stuff. Some do, and a lot of them are in our community. But the vast majority of medical doctors, they don't take that time. They don't have the time. In the course of their day, it's patient 6 minutes out, patient 6 minutes out, patient 6 minutes out. And it's just this formulaic all day long, right? In and out, drug, in and out, procedure, in and out. And it's just, they never have the time to stop and really look and assess at what's out there. And that's why they trust like the American Medical Association and other groups to keep them on top of things. But the problem is a lot of those are now heavily influenced by pharmaceutical companies, and we know what they're pushing. In fact, I always found it curious that these doctors who don't have time for anything will sit in a pharmaceutical pitch, and it could be upwards of an hour. Now, the pharmaceutical guy or girl, usually very attractive person, comes in with a briefcase, comes in with donuts or lunch, and then pitches their drug. I always wondered what would happen if I went down to the local doctor's office just down the road there. I could go into the doctor's office and say, hey, I'd like to come talk to the doctors and everybody about a brand new protocol that could be revolutionary in the health and weight of their patients. And I bring in prime rib steak, and they can eat that. And then I proceed to do a presentation all about low carb and keto and why controlling insulin naturally through nutrition, They ain't gonna let me in the door, are they? So what's the difference? It's a little bit of a side rant, but Kristin starts this off with the typical kind of interaction on or in doctors' offices between patients and doctors. The doctor's flabbergasted. Why isn't this patient getting better? They're doing all the right things. They must be lying, and that's the biggest bullshit one. I so got over that one real fast. Why are we blaming patients? Now, some of them may not be doing what they're saying they're doing. Some of them are very slick at telling the doctor what they think the doctor wants to hear. But I think the vast majority of people that have been frustrated have indeed tried all the quote right things, and they just not seeing the results they wanted. So she outlines that pretty well. If you're just joining us, I am reading from an article that's in the San Diego Physician magazine, just came out a couple weeks ago. And it's written by one of our own keto doctors out there, Dr. Kristin Baier. She's doctoring keto here on Instagram. Go look her up, you guys. Go follow her. But she has a great article here called Metabolic Health in the Time of 9-1 DIVOC. So we're going to continue with the story. This patient situation, talking about the sick one that we just talked about, has become all too familiar for primary care providers and specialists. Despite their best efforts and medications all at their fingertips, patients keep slipping further and further into the despair of metabolic disease. Now, if I'm a doctor and I'm watching patient after patient after patient not only not get better, but get worse, and they're doing, all the things they've been told to do. They're following all the mandates, all the protocols that you as the medical professional are giving them. How frustrating does that have to be? That despite your very best efforts through medication, through the dietary guidelines for Americans, which are supposedly the most healthy way to eat, all of these things you're telling your patient to do, and they're still not getting better. That has to be frustrating. And I've interviewed many over the years on my podcast, many medical doctors who said they were just about ready to give it all up because they were just frustrated by how little health was going on in their doctor's office. Now, if somebody came in with a broken arm, fix it, bada bing, bada boom, done. If somebody came in, with some other acute injury, bada bing, bada boom, done. But diabetes, obesity, heart disease, Alzheimer's, cancer, all of these things have now become a we don't know what to do about it kind of situation. And if I'm a doctor, I'm going to study and look at all options on the table. Now, I realize they don't have a lot of time, and they're very overworked and tired, and I get all that, but something has to give that lets these doctors have a sneak peek into all of this stuff that now all of us know, you guys watching Jimmy Rants, can be helpful. But it's got to be frustrating for doctors. Researchers at the University of North Carolina Gillings School of Global and Public Health examined National Health and Nutrition Examination Survey data, that's the NHANES study, from 8,721 people in the United States between the years 2009 and 2016. Listen to this, you guys. The data revealed that 12.2% of American adults are metabolically healthy, meaning, this is what metabolically healthy means by that definition in that database. Optimal waist circumference, so your waist is what it's supposed to be. Fasting glucose number in the optimal range. HDL cholesterol is going to be higher. Triglycerides, lower. And blood pressure, lower. That's how they define optimal health. The people in the optimal range, you guys, 12.2%, which means 87.8% of the population is more vulnerable to developing chronic disease, including type 2 diabetes. This is the unspoken. And you guys hear me throw that stat out, about 88% of the population has some level of metabolic damage, insulin resistance going on. And that's the statistic. That's the study I always quote. And it's shocking, 88%. That's 9 out of 10 people. Meaning, and not everybody has the same level, by the way. There's some that are very metabolically unhealthy, and then there's some that have a tinge of it, and then people in the spectrum in between. But these are the people that are very vulnerable to disease because of all those factors. While we are leading the world in many aspects of medicine, talking we being America, metabolic disease is now the Achilles heel. And if anything 9-1 DIVOC has shown us is just how metabolically unhealthy we are. Because look at the people who have been most susceptible to it outside of older people. 75 and older, that's one category. The next category are people with comorbidities, upwards of an average of 3 comorbidities. And these comorbidities are things like elevated fasting blood glucose, lower HDL, higher triglycerides, higher blood pressure, obesity. All of those things become these comorbidities, which once this virus hits your body, make you more susceptible. 9-1 DIVOC has brought renewed interest and urgency into successful treatment and prevention of metabolic syndrome. 9-1 DIVOC statistics obtained from the CDC clearly show higher morbidity and mortality associated with metabolic disease, specifically diabetes and obesity. I remember when I used to attend a lot of these obesity conferences 10, 15 years ago, I would hear presentations from people like Dr. Jeff Volek and Dr. Steve Finney, that guy back there on the wall, and many other, Dr. Eric Westman, many others. And I remember Dr. Volek specifically, along with Dr. Richard Feynman, did a study where they looked at all the traits of metabolic syndrome, which is all these things that I just mentioned and more. And then they matched up what diet fixes the things in metabolic syndrome. And it literally, all of the things that got better in with a low-carb ketogenic diet were exactly the things in metabolic syndrome. So they said the answer to metabolic syndrome and metabolic health is to put people on a lower carb type of diet. And here we are all these years later, over a decade later, And now we're seeing the ramifications of why that was great advice, because people are more susceptible to 9-1 DIVOC because of that. So there was a study called the Coronado trial. It demonstrated that being overweight and obese are associated with poor early prognosis in those patients with type 2 diabetes hospitalized for 9-1 DIVOC. 10% of the hospitalized patients died within 1 week. 65% of diabetic patients with 9-1 DIVOC admitted to the hospital are men. So 2/3 of those going to the hospital with this virus are men. Another study confirms patients with type 2 diabetes are prone to developing severe and critical 9-1 DIVOC with very poor therapeutic effect. This is something not being talked about a lot with the V word, by the way. When you are obese and when you have some of these comorbidities going on, any treatment option for helping you deal with 9-1 DIVOC is going to be severely diluted because of your weight. And so they're not really talking about that a lot in the mainstream with this drumbeat to everybody get the V word. But if you're obese, that V word ain't going to work nearly as well, at least in the dosage that they give everybody else. It ain't going to work near as well with those people as it would with people more in line with their weight. So, and they're saying, and Kristin's saying in this article, even a lot of the therapeutics that are being used, even zinc and vitamin D and vitamin C and all the other things that are out there, you have to go higher doses with somebody with more weight on their body because there's a lot more to get through to give you the effects. So the complications of metabolic syndrome prior to 9-1 DIVOC have been well established, yet barriers to successful, sustainable treatment and prevention persist. At the root of the problem is the failure to adequately address the decades of lifestyle choices that lead to insulin resistance to begin with. And quite frankly, that falls on the medical field. I think we are going to have a revolution happen in medicine. It has to, you guys. If anything 9-1 DIVOC has shown us is we got to get better at prevention so that we don't have a panic mode on the back end with all these people falling susceptible to something preventable like 9-1 DIVOC. Most people who have a strong immune system and not all these comorbidities should be able to handle 9-1 DIVOC very easily. But what's happened is they've been metabolically sick for so long because they've been given the wrong information for so long that now we're seeing the ramifications of that. And it breaks my heart that we're seeing all these people get sick. We're seeing all these people that die. And it's needless. And if it's as simple as improving nutrition so that the metabolic health is improved, then so be it. But they need to teach that in the medical school. I don't know how medical schools have turned a blind eye to the critical role that nutrition plays in your health. And people are shocked when they find out how little nutrition knowledge their doctor has. Their doctor's literally parroting what the USDA Dietary Guidelines for Americans says, which, oh yeah, by the way, the 2020 version of that is out. I'm going to do a little mini rant on that on the Ask Me Anything on Friday, so stay tuned for that at the very beginning of Friday's Jimmy Rants. But the new ones aren't any better, guys. And so if that's the protocol that the doctors are promoting for patients to get healthy, we know that it's going to bomb miserably. How did doctors sit by and year after year after year after year and see all these patients get sicker and sicker and sicker, more drugs, polypharmacy, and it just becomes this, that's a miserable feeling if you're a medical doctor. I could not imagine going to work and knowing you're not going to see people get better. And this is why when I interview doctors, which by the way, I'm interviewing Dr. Baier, Dr. Kristin Baier on the Living La Vida Low Carb show coming up a couple weeks from now. I think the interview is actually this Friday. I will interview her and then it will air in a few weeks. So look for that. But I interview so many of the keto, low carb, paleo, carnivore doctors, and almost every one of them says they have a spring in their step when they get up in the morning because they know they're going to get people off of insulin. They know they're going to see results that are making their patients more optimal. That's exciting, guys. I could not imagine being a medical professional wanting to make a difference in the world, which is why a lot of them got into the profession, only to see patients get worse and worse and worse every year. And it's all those lifestyle choices that they're making because they don't know what to do, and neither do the doctors until they become awakened. In our current healthcare system, physicians are burdened with time constraints that are imposed by hospital administrators and the insurance companies, as well as the pressure to be profitable. This is something people forget about. They just think, oh, doctor, rich. And they don't realize, oh, these doctors are basically slaves to a system. And the system demands certain things that are very highly unreasonable. And yet they're required to do it. And if they don't do it, they get dinged on their record. If they don't recommend a certain amount of medications in a month, they get dinged. If they don't, ICD code things correctly, they get dinged. I mean, there are so many things that if you knew what your doctor had to go through, you'd be like, oh my God, no wonder he doesn't have time to read the latest nutrition studies. No wonder they look so sad. Because they are sad. They're in a system that's broken, hopelessly broken, and they don't know how to get out of it. Treatment of metabolic syndrome and obesity becomes secondary to other quality control measures and comorbid conditions. So they're not even treating obesity directly. They're saying, oh, well, you're fat, so they don't say it that way, but I'm just cutting to the chase. You're fat, so that could explain why you have diabetes. You're fat, so you got heart disease. So lose a little weight, maybe that'll help with that. In the meantime, here's some drug, here's some insulin, here's some... And you see how they operate. And that's how it goes. Pharmaceuticals help treat the lab values. Listen to this line in Kristin's piece. Pharmaceutical drugs help treat the lab values and symptoms, but they often neglect the underlying cause. Think about all those people who take a statin medication to, quote, lower their cholesterol. And they take that medication and they think, because I'm taking this medication, I'm heart attack proof. And so if you think you're heart attack proof, you don't really care that you're having pasta. Whole wheat pasta. It's healthy for you. You don't care that you're drinking orange juice for breakfast and having a banana. It's healthy. It's got a lot of sugar, but it's healthy. It's natural sugars. And so they give these pharmaceuticals, but they're not treating what's actually wrong. I think about all the diabetics who take blood sugar lowering and insulin modulating drugs. And the primary purpose of those drugs is to manage the carbs you're eating. Nobody tells these people, you don't need those drugs if you just cut your carbs down. How easy would that be? And that's what she's talking about here. Doctors are giving out these pharmaceuticals to treat the lab numbers. Oh, okay, well, I see the blood sugar in the range I want it to be now. Good job. Rather than, oh, okay, let's take you off the drug. Now let's see what's happening that's making your blood sugar go up. Oh, you're eating oatmeal for breakfast? Oh, wow. Why don't we remove the oatmeal and have some bacon and eggs instead? And that treats the root cause. These pharmaceuticals are merely a Band-Aid that doesn't stop the bleeding. It takes only minutes to order some tests and write up a prescription, maintaining the subpar standard of care. And oh my gosh, subpar standard of care. So the standard of care is doctors are required to do certain things if they see certain values on their patients' lab work. And so if they see a higher cholesterol level, oh, standard of care, give them a statin. Oh, they see higher blood sugar or insulin levels, oh, metformin and other diabetes medications, maybe some insulin, standard of care. So they're following meticulously this standard of care. And I love how Kristin describes it as subpar, because all of these so-called standard of cares, all they're doing is just covering up what the real problem is. Don't you want the doctor to get to the root cause of issues rather than just giving you this blasé answer because that's the textbook answer to everything? I do. This is why functional medicine has gotten a strong foothold in the medical world. This is why naturopaths and other people talking about nutritional health in conjunction with some medical care, they're growing as well. Mainstream doctors are not getting with the program. And I think they're going to be way left behind, other than a few to fix broken bones and to sew you up when you get cut. That's what they're good at. They're not good at chronic disease. Additionally, inadequate nutritional training, which I talked about earlier in medical school and residency, a lack of insurance reimbursement for lifestyle interventions, that's a big one. You want to know why your doctor doesn't spend a lot of time talking about nutrition? Well, number one, he doesn't know about it. But number two, there's no ICD code for a lifestyle intervention. And so if he even wanted to put you on a low-carb ketogenic diet, there's no ICD code. He won't get reimbursed, he or she. And so that's the problem. And it's all about making the money. They got to come up with the code that then the insurance will pay and keep the cash flow going. And again, you don't want it to come down to dollars, but it really comes down to dollars, guys. As much as we want to think healthcare is different, healthcare is supposed to be about the patient and making them healthy. Reality check is still about money. And they're still going to do the things. This is why there's lots of procedures involved in medical care. I would argue a lot of unnecessary procedures involved. A lot of the open heart surgeries, they didn't need to go in and do all that. A lot of that could have been preventative had they just given the patient better advice early on. And the misleading epidemiological studies, and I've talked about many of those on here before, where they look at populations from various studies, and they say, well, we see across all of these very bad studies, we're going to make one very bad conclusion about these very bad studies. And they do that early and often. This is the so-called red meat will kill you. Cholesterol is the great enemy and it's going to clog your artery. And it's like they just make things up based on these epidemiological studies. It's horrible. All of this, from the lack of medical school nutrition training, lack of reimbursement from insurance for lifestyle intervention, and these misleading studies, all of those have resulted in very well-intentioned but highly flawed dietary guidelines, which again, 2020 dietary guidelines just came out. And I'm going to do a little mini rant at the beginning of Ask Me Anything on Friday, so don't miss that. This has added to the frustrations of lifestyle counseling in a medical setting, which is what Kristin and her coworkers in the Low Carb MD San Diego office are trying to do. They're trying to be lifestyle counselors for their patients because they've been awakened to the role that carbohydrates play in insulin and blood sugar and inflammation levels and all the rest. The Eat Less, Move More campaign has been an epic failure as it fails to address the endocrine adaptations and satiety mechanisms that are crucial for weight loss. This is something that they recognize and they know. They get people on keto, they won't be as hungry. And yet if you tell people eat less, move more, what's that doing? It's going to make them hungry. They're not going to feel satiated. They're going to be weaker. It's a horrible, horrible advice. And yet it's still the advice that is the go-to for so many doctors. As a society, we have prioritized financial gains from the highly inflammatory processed foods. And I would include in there not just processed carbohydrates, but processed fats like the seed oils. Guys, if we really knew the cost of all those seed oils in just about every packaged food and even like deep frying stuff in seed oils. My God, how many years did I do that? And here's a funny thing. Once those fats are in your body, they actually come and become a part of your body. A lot of those old seed oil fats, I remember Dr. Kate Shanahan told me this in my interview with her last year. Once you eat seed oils and you keep eating them and you've got layers of body fat, guess what? There's some seed oils deep inside of there. So that as you lose weight, then those get released. And oh my God, so if you have elevations and inflammation from time to time as you're losing weight, that's what it is, guys. You're releasing a lot of those old seed oils. Nobody's talking about that. Nobody's talking about these highly processed, highly inflammable food-like disease agents, as I call them. We should instead be choosing nutrient-dense whole foods. And if we did that, that would improve the health of our country, which again is a well duh. Not once have they told us, eat better food, eat real food, get sunshine, move all the things. They just haven't done it. So attempts are being made to address all these holes in the metabolic and obesity training. The American Board of Obesity Medicine has recognized the challenges that physicians face, and as a result, they created a certification focused on education pertaining to all the complexities of obesity management and all the associated comorbidities. I want to know why that hasn't happened before now. Now, I know this group, this American Board of Obesity Medicine. They used to be called the American Society of Bariatric Physicians, but I know them, and they have been focused on this. But they are a very small group of doctors in a very big sea of doctors. And unfortunately, until some of these bigger organizations get on board, it's not going to really go anywhere. The problem is all those other associations are heavily funded by pharmaceutical companies. You get big pharma out of the equation and metabolic health becomes a priority, with a low-carb ketogenic diet being the basis for every insulin-resistant patient. Starts tomorrow if you get the pharmaceutical industry out. The problem is the wolf's in the hen house, and the wolf's having a heyday. As one of the few specialty board certifications that does not require a long-distance residency, talking about this thing from the American Board of Obesity Medicine, it has gained popularity in recent years as the obesity epidemic continues to grow. From 1999 to 2000 through 2017, 2018, the prevalence of obesity, listen to the jump just in those about, it's like 18, 19 years. The obesity rate went from 30.5% in 1999-2000 to 42.4% 3 years ago. And the prevalence of severe obesity went from 4.7 and it basically doubled to 9.2. Clearly, we have a need for better management and education, but will this be enough to sufficiently address the obesity epidemic? As a diplomat of this organization, I can attest that anti-obesogenic pharmaceuticals are very encouraging. There are some good ones out there if people are still having trouble. Modestly effective, so they do have some efficacy, and they're considerably safer than surgical interventions in appropriate candidates. However, they don't replace lifestyle and behavior interventions needed to achieve long-term results. Having a team of obesity certified physicians, bariatric surgeons, dietitians, and psychologists would provide comprehensive care, but would also be very time-consuming and costly for patients. Man, I have dreamt of the day that I could walk into a medical facility and go see some specialist with whatever it is I'm dealing with. So if I have a heart health issue, I go see a cardiologist, but then there's other specialists along the way, and I love this. You got board-certified obesity physicians, bariatric surgeons, dietitians, psychologists. I think across the board, I think an exercise physiologist would be kind of cool, and have all of this on the same campus, but it's extremely expensive to do that totality of medicine. So at the forefront of her training and the overall approach to treating metabolic disease is the role of insulin resistance on weight loss. This is missing currently from the medical school curriculum. Doctors correctly associate insulin with glucose homeostasis. As a result, we are taught to check glucose levels. And if glucose levels are within the proper range, then we just assume insulin is within an acceptable range as well. That range is between 70 to 100 milligrams per deciliter for your blood glucose, and if the HbA1c is less than 5.7. Now, I would say the 70 to 100 with blood glucose, perfectly fine, but it's not a surrogate marker for insulin. If any doctor ever tells you, oh, your glucose is fine, what about my insulin? Well, it's fine too, because your glucose is fine. You better fire that doctor, because that doctor should never assume that a blood sugar in line means your insulin's in line. Because here's the thing, when you are becoming insulin resistant, your blood sugar could be 88, for example, and you assume that insulin is good. But what happens if they test insulin and it's 32? What you found out was that your body over time had to pump out more and more and more insulin to get that blood sugar into a tight range. And you got to know your body is working hard to keep glucose at a tight range. Insulin to bring it down, glucagon to bring it back up and keep it in this really nice, healthy range. So if you only test glucose, you're not seeing the insulin hormone. So have them do both. By this assumption, referring to assuming that your glucose in line means good insulin, we are missing a 10 to 15 year window of opportunity to intervene when we fail to routinely check fasting insulin. Guys, I had to fire my doctor just over there, less than a mile away, had to fire the bad boy because I went in. This is like 5-6 years ago. I went in to get a fasting insulin done along with all of my other markers for my checkup. I was doing the annual checkup and I noticed insulin was not on there. And I'm like, I want fasting insulin run. You can't have it run. You're not diabetic. And I'm like, that's crazy. I'm like, I want it run. The doctor said no. I said, I will pay for it out of pocket. It's $50 test. I will pay for it. No, we won't run it. And so I ran what he did run, had the last consultation with him, thank you very much, and sayonara. And I had to let him go. It's ludicrous that a doctor would not run a fasting insulin. And that's what Kristin's talking about here. We're missing this opportunity that if you catch a fasting insulin level that's elevated, even with a normal glucose, you're going to catch a lot of metabolic disease before it develops. And this is why we have that 88% insulin resistance going on. Glycemic hyperinsulinemia is when an increase in visceral adiposity, which is belly fat, hypertension, high blood pressure, and unfavorable lipid patterns, which is low HDL cholesterol, high triglycerides, begin developing. As the main fat storage hormone, insulin is what drives weight gain. When prediabetes develops, insulin is already detrimentally elevated and could have been for a decade. If every doctor isn't running fasting insulin right now, you should be. And I know that I've been waiting on an at-home insulin test. If people can test their insulin at home, and it's coming, you guys. It may not come for another few years, but it's coming. Once people can test their own insulin, the game will change dramatically. Because you'll go to your doctor and say, hey, I got a 40 insulin level. What's up with that? And they'll have to finally address it. Prevention and early intervention efforts at maintaining insulin sensitivity prior to hyperglycemia are critical. You don't just develop type 2 diabetes overnight. You don't just develop heart disease overnight. You don't just develop Alzheimer's disease overnight. These things develop years, decades. And if we simply ran a fasting insulin, we would catch them long before they happen. She's so right here. And this is the major glaring hole that's missing in the whole healthcare system. Why does it take a layperson like Jimmy Moore to point this out? It seems so self-evident, right? And I've been screaming from the mountaintop about this for 15 years, trying to get people to understand your insulin matters. The doctor refuses to run it. You figure out a way to run it. There's all kind of ways you can run it yourself online, by the way. Here in America, those of you that are international, sorry, I don't know what it is in your country, but here in America, there's only like 4 or 5 states where you can't run this. But here in America, you can actually run your own labs. So there's this Any Lab Test Now. There's little centers all over the country, and anylabtestnow.com. I use this one called privatemdlabs.com. You can run pretty much any test that you want in the medical world. Now, still find you somebody to help you interpret those tests, but you can run your own tests. And that's how I run my fasting insulin now. It's how I run a lot of the tests that I do. Discouragement over seeing patients slip further and further into the RAS of their disease has created a need for a new branch of medicine: weight loss through metabolic health. We need a lot more of those. Imagine for a moment that you go to a practice that is focused on reducing your insulin levels, and thus, by doing that, improving insulin sensitivity that will ward off all chronic modern disease. That's preventative care. I think that's what people think they get when they go to see their doctor. They think that doctor's giving them things to help prevent disease. It ain't happening, guys. One that can cater to the patient's desire to learn more about proper human nutrition, physical conditioning, stress management, psychological barriers to implementing change. With competent execution, medication de-prescription becomes the norm. In other words, you're already on meds. We're going to take you off of meds. The patient's vitality and energy returns. Healthcare costs actually go down when you do this. Appointments become fewer and further between, and physician job satisfaction returns. All the low-carb doctors you love out there, you guys, this is their life. This is exactly what they're doing. And it's a business model that could be replicated if other doctors would just see the vision. I don't know how doctors like Kristin and others, Dr. Westman, all the ones around the country, how they have a pool of patients that get better, and how there's no curiosity by other doctors wanting to look at those records. I'll tell you, Dr. Westman has told me many times that he gets referrals from other doctors. When other doctors get so exacerbated by patients, they're like, we don't know what to do with you. We're sending you to Westman. And of course, Eric gets them, and he's like, okay, well, let's talk about nutrition. Literally, that's all he does. And all these other doctors could easily do it. They just choose not to do it, which is curious to me. Low Carb MD San Diego, which they have a website. Go check them out, lowcarbmdsandiego.com. It opened last year in July. It's a membership-based model designed to combat the afflictions of metabolic dysfunction, things like obesity, dyslipidemia, type 2 diabetes, non-alcoholic fatty liver disease, and hypertension. The medical weight loss programs offered emphasize nutritional interventions that will help reduce your insulin resistance, lower inflammation, and energy toxicity for restoration of appropriate metabolic functioning. While metabolic health improves, weight naturally settles in the healthy range with preservation of muscle mass and lean tissue. This is what I tell people all the time. Don't lose weight to get healthy. You need to get healthy in order to lose weight. Now, it seems so backwards from what we've been taught all of these years, but you truly need to get healthy. And how you get healthy is changing the diet, changing the lifestyle, implementing various practices. I use various practices, you guys. I meditate. I've got red light therapy. I've got infrared sauna. I've got stress management types of things that I do. Got like a massage chair and a hot tub and all the things. All the things that will make you healthier on the inside. And through that manifestation of being healthy, you should be able to lose weight on the outside. Now, there's X factors involved with all of these things. But in general, that's supposed to work. Within a matter of just a few weeks of therapeutic carbohydrate restriction, liver size decreases, blood glucose returns to normal, and it does happen very quickly. This type of practice is similar to a direct primary care or a concierge structure, but it has a niche comparable to specialty care. So they're saying if you're used to going to see your doctor and having a typical copay, 20, 30, whatever dollars that the copay is, and then if you have things done, you pay a certain percentage, blah, blah, blah. That's the standard kind of model. Concierge care of a specialist gonna be a little more expensive, but look, more expensive, but more effective. Would you rather pay a little to get bad care or pay an appropriate amount to get the best care? I think if you ask most people, they're willing to get the best care. They want to be better. They don't want a Band-Aid, and yet you're still bleeding underneath the Band-Aid, right? It is designed to complement the primary care physician who does not have the adequate time or resources to address obesity or to treat the underlying cause of metabolic syndrome, which is insulin resistance. I love that. We're not saying fire your doctor. We're saying because your doctor doesn't have the time and doesn't have the knowledge about how to treat metabolic disease, come see us. We're physicians as well, and we will help fix that part so that your doctor's job ends up being if you hurt yourself and you need acute care where you need sewed up with stitches, you need bones put back together again, let them do that. We know how to do that too, but let them do that. We want to take care of the chronic disease. Surgeons have also found utility in this care model as a way of reducing surgical complications related to non-alcoholic fatty liver disease and hyperglycemia. So non-alcoholic fatty liver disease, by the way, primarily promoted from the consumption of fructose, because that fructose can't get metabolized. It has to go right to the liver, and it just churns and churns and churns in the liver until it becomes fatty. And it ain't good for your health once your liver becomes fatty. By utilizing a membership fee as opposed to using insurance, requirements that limit doctors previously have been lifted. This allows for an increase in time spent with patients. So the reason they're doing the membership fee instead of going the insurance model, insurance requires they only get 5 or 6 minutes with the patient and they're out. Kristin knows they need more than that to teach them. And so in their business model of having a membership fee, it lets them pretty much do whatever they want with the patient to educate. So they provide education, they address any underlying impediments to weight loss. Patient rosters can be 1/3 the size of a traditional practice. So they don't have to have a ton of patients in order to make this work. Overhead costs are greatly reduced by eliminating the need for support staff handling insurance claims and billing. Can you imagine how hard that is on most doctors' offices? Through remote monitoring and communication platforms, a partial or completely virtual experience is also possible. So you could go wherever you live. I don't know if they take foreign patients. So I see a few of you are from Canada on here. I don't know if they take Canadian patients, but I know that they'll take them in America. But that's interesting that they could see you virtually like that. It could further reduce overhead of a brick and mortar location. In addition, metabolic health improvement has shown to increase your survival from 9-1 DIVOC by improving insulin sensitivity. All of this is in addition to reducing exposure through customary hygiene and safety practices. True health extends beyond prescriptions to controlling symptoms and lab values. Innovative, progressive, and effective options exist as an adjunct to the care that you're already being provided. So guys, once again, Dr. Kristin Baier, in fact, I got a picture of Kristin on my phone so you could see her. There's what she looks like. For those of you watching the Instagram feed and on the replay, that's Dr. Kristin Baier, wonderful lady, sweetheart of a lady, and just really knows her stuff when it comes to the ketogenic diet and the impact on your metabolic health. And the name of her article right there, Metabolic Health in the Time of COVID. And you can go look that up online if you want to read it. But wonderful, wonderful article, Kristin. Once again, she's in the San Diego, Low Carb MD San Diego. She's a CMA SDCMS member, double board certified in obesity medicine and family medicine, has a passion for helping their patients regain health through lifestyle modifications. So really, really good stuff, you guys. I thought you would enjoy that here today on Jimmy Rants. And now I want to see what you guys have to say. So come on in, make yourselves at home. We're going to go here first over to Instagram, then over to Twitch, if somebody will give me a question on Twitch, then over to Facebook, finally over to YouTube. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. Let's see what you have to say on this one. Joshua says there's a whole submarket of patients now for the doctors that want to get into chronic disease, things like Lyme and etc. The difficult patients, yeah. That is what Dr. Westman is known for. If a doctor has difficult patients, they're like, okay, Westman's going to take care of you. We don't know what he does. We don't want to know what he does, but he makes people better. It's crazy. Keto Blazer RN says my endocrinologist actually recommended keto instead of increasing my diabetes medications, and I got off all the meds except for Ozempic. No more insulin, metformin, or glimepiride. That is awesome. Joshua says our body stores toxins in our fats. Yep. I think this is why fat loss isn't usually a straight line. Yeah, people don't realize when you have body fat, it's layers. And in those layers, there are all kinds of toxins. And so sometimes people start losing weight and they feel bad suddenly. And they don't know why. Whoa, I'm losing weight. Why do I feel like crap? Well, that body fat that's been on your body and trapped away inside of your body is now being released into your bloodstream. Well, if they're full of toxins, guess what? I'm going to feel bad. And so just know that ahead of time, that if you try to lose weight and you start to feel ill or you have an elevated blood sugar. I know Dr. Fung and I, in our book, The Complete Guide to Fasting, we talked about little pockets of sugar being trapped in the stored body fat as well. And so sometimes you'll be on day 10 of a fast and you'll see a spike of blood sugar at 130. You're like, what in the world? Where'd that come from? The body fat being released and things being bound up in there. So you're right. Alrighty, thank you, Instagram. We're gonna go over here now to Facebook because Twitch is being silent on me again. What's up, Facebook? See what you guys have to say. Hello from South Africa. Thank you for being here from Cape Town. I miss Cape Town. Y'all just wanted to say hi today. No engagement today. Cat got your tongue today, huh, Facebook? All right, well, thank you for being here. We're gonna pop over here now to my YouTube channel. What's up, YouTube? You guys gonna come through with some comments? Ann says, I hope YouTube plays nice today. It looks like it did play nice today. I don't know what happened yesterday, but thank you for being here. I'd rather have prime rib than donuts and drugs. Yeah, exactly, Ann. Jomo says, so sad. I wish more people knew this. Well, Jomo, you know I am always passionate about sharing. And I try to do that early and often because I just feel like people deserve to know all of this information. And unfortunately, they don't. Unfortunately, it's just not widely known or accepted because it's not reinforced by doctors. And there's a lot of people that if their doctor doesn't say it, they don't believe it. And that's just the sad reality of the world we live in. Okay, you guys, so that's it. Go check out Dr. Kristin Baier's article, Metabolic Health in the Time of 9-1 DIVOC. And again, it was in this magazine, San Diego Physician. And I'm real excited to talk to her on Friday. I think it's like 1:30 on Friday, about an hour or so after I'm done with Jimmy Rants on Friday. I will be interviewing her, and then that'll be coming up on the Living La Vida Low Carb show here in a few weeks. So look for that. And we've got an interesting topic. When I said, hey, what's got you like really jazzed right now? She put a topic out there that I went, oh, that's going to be controversial, but let's do it anyway. I love controversy, so stay tuned for that. And that's it for this episode of Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content. Come follow me right here over on Instagram. I'm Jimmy Rants over on Instagram. Check us out, you guys. Monday through Friday, 11 a.m. Eastern Time. Thanks so much for being here. We also simulcast on Twitch, Facebook, and YouTube. Thank you all for being here today. If you missed the live, you can watch it on the replay right here on IGTV on the Jimmy Rants feed. We also have it over on Twitch on replay as well as over on YouTube. Just a reminder, on YouTube today, we do have a few extras for you. Go check out the One Step Deeper podcast, which aired yesterday. And it's all about the Enneagram. If you've ever wanted to learn about Enneagram, I did a Jimmy Rants on Enneagram last year, but we went really deep in kind of explaining all the different types of the Enneagram. Go check that out. Also today, I posted an older interview I did about a decade ago with Drew Manning. You may have heard his name. He's the Fit to Fat to Fit guy. He just turned 40. He and I have the exact same birthday, December 27th. So December 27th, he turned 40. So in the 4 months prior to that, he purposely gained weight. Now he's a stud, like a personal trainer who has six-pack abs and da-da-da. And so he put on weight so that now he can lose the weight. He did this 10 years ago, and I remember interviewing him about it. So I'm airing that older interview with him over on YouTube today. Go look up that video. I just posted it today. And I've got an interview with him coming up real soon on one of my podcasts here in a couple weeks. So stay tuned for that. And then finally, go over to JimmyRants.com, see all the past episodes there of Jimmy Rants. And yeah, we're rolling, guys. We're rolling. So tomorrow, I have an article that I'm going to read from and expand upon on 7 habits that are scientifically proven to help you beat procrastination and to tackle your to-do list. So a lot of people have no motivation and they're really good at procrastinating. So I thought what they offered in there was good. I've got a few things to say about that myself. As someone who is highly productive in my work, I'm going to share some of my wisdom with that as well. That will be tomorrow, you guys. So until then, we'll see you then. All right.